Good afternoon, good evening. Thank you so much for joining us for the AfricaCDC Mpox briefing. My name is Margaret Edwin, the Director of Communications. I will be moderating this session. The main speaker is Dr. Kaseya, the Director General of AfricaCDC, who will provide the situation analysis. I will now hand it over to the DG. Over to you, DG.
Good morning, good afternoon, good evening to some of you. Today we are taking this call from Washington, D.C., where we landed to have some exchange with the Pan-American Health Organization, PAO. And tomorrow we are signing a memorandum of understanding that will link the two continents, the two regions, Africa and Latin America, mostly PAO. Last week, we were in Burundi, in Morocco, to support our countries that are affected by Mpox. And today, we'll give you a kind of update on where we are with Mpox in Africa. Colleagues, can you please proceed with the PowerPoint? Okay, next slide. This is where we are today in terms of cases of Mpox in Africa. The week 36, we have 2,952 cases, and we have 738 deaths. You'll see, next slide. You'll see that in 1 week, we had 2,912 new cases if we compare with the previous week. And also, we have a new country, that is Morocco, that is making all African regions affected today, bringing the total of countries to 15. And as you can see, we still have people dying from Mpox in Africa. In 1 week, we lost 14 people. As we said, one person who can die due to Mpox is an additional death that we need to say enough is enough. We need to stop that. And you can still see that our young people are affected with an average of 41% if we compare with the number of cases that we have. But this figure is changing if we go country per country. Next slide, please. Next slide. Can we go back to the presentation?
More to the right of that, it'll be on the table.
Next, could we have the presentation?
Okay, I will share that from my screen, and I will control that from my screen. I think there is a issue in Addis. Okay, next slide, please. As you can see, we said more than 2,900 new cases if we compare week 35 to 36. But if we compare the same week, epidemiological week, 36 in 2024 and 2023, the increase in terms of cases is about 177%. Even there is an increase in terms of deaths of almost 38.5%. We can say today that Mpox is not under control in Africa. We still have this increase of cases that is becoming worried for all of us. I wanted also to share with you that in many countries, we have a combination of different clades. We have to say that the Mpox outbreak is a combination of so many outbreaks in one. You'll see in DRC, in Kinshasa, the capital of DRC, we have a circulation of clade 1A and clade 1B at the same time. You'll see in Cameroon, we have clade 2 and clade 1 at the same time. But because our surveillance system is not strong enough, because our testing is not, lab system is not strong enough, we cannot confirm that everywhere we can't have this kind of joint circulation of clades. And when you have many clades together, you don't know what will be next. And we have so many studies ongoing to see how that one is affecting the fight that AfricaCDC and partners we are organizing against this outbreak. Next slide, please. This one is just to show you how we are analyzing all clades, cases, deaths, and how we are making a priority when we have to say, where can we go in terms of vaccination campaign? Where can we go in terms of reinforcing the surveillance system? Where can we go in terms of reinforcing the lab system? This is an example of DRC, where we have more than 90% of cases. And you'll see it's just giving you the way at IMST level. It means the team that is managing this outbreak, how we are analyzing the data and how we are moving with the response. Next slide, please. When we talk about response, we want to start with what we call the coordination. As you know, we have this incident management team that is based in DRC, bringing together all partners under the co-leadership of AfricaCDC and WHO. What we are doing is to make the fight against Mpox not only AfricaCDC issue, not only WHO issue, but it's for all of us. We are glad to see that the person who's representing Africa, it means the chair of African Union, who's also the president of Mauritania, together with the chairperson of the African Union Commission, His Excellency Moussa Faki, they issued a statement 3 days ago to talk about what AfricaCDC and partners are doing to stop this outbreak and to commit on behalf of all of our leaders to support AfricaCDC and partners to stop this outbreak. More than that, they managed to convince other leaders to have a meeting of head of states and government on the 22nd of September. It means in the next 3 days. And this is a major information that we are sharing with you. In 3 days, there will be a virtual meeting bringing head of states from the committee of head of state. It means 10 of them, plus countries that are affected, under the leadership of the president of Mauritania, supported by the president of South Africa, who is the champion for pandemic preparedness, prevention, and response. And we're expecting this meeting to be at the same time for more commitment in terms of how to strengthen the surveillance system and the lab system and the communication component, but also for the fundraising to see our member states providing more funds and our partners committing to stop this outbreak. I want also to share with you that last week we were in Morocco, where for the first time in 2024, we saw the first case of Mpox. There are still a number of tests ongoing for the 3 cases, suspected cases that we had there. And we'll give more information when we get the overall picture of what is going on in Morocco. We were also in Burundi. And the photo you can see there, it's when I was visiting a center where the government is doing what we call the case management of Mpox. We are glad to say, despite 1,600 cases that we have in Burundi, we have officially 0 deaths reported. Then we want to learn why in Burundi you have the same clade, the same population affected. It means mostly young people. Why in Burundi we have 0 deaths, while in DRC we have so many deaths? AfricaCDC and partners, we are conducting studies to understand, and maybe that will help us to also stop what we are seeing in DRC. We want also to share with you, because we have this incident management team that is comprised by a number of partners. I want to share with you that there was a joint mission in one of the regions affected in DRC. We call it Equateur, in the north of DRC, to see how to support this region, not only to strengthen the system, but also to be ready to start the vaccination campaign. And we have a lot of lessons that we learned from this joint visit. Because we are talking about strengthening capacity, in a number of countries, we are getting requests to provide more surge capacity. Together, AfricaCDC, WHO, we managed to provide around 344 epidemiologists to countries that are affected, in addition to their own internal capacity that they have. We are committed to provide more support, and will continue to provide more support to affected countries based on their needs. Next slide, please. Let us talk about vaccination. Yes, we have a success story, because most of our communities, most of the journalists are asking, when are you start with the vaccination campaign? We started in Burundi, in Rwanda, sorry. Even I invited my brother, Minister Sabine, from Rwanda, to attend, but at the same time, there is a pandemic fund meeting, and when he can, he will join. Otherwise, he will even send a director. If the director is there, he will tell us, because we wanted Rwanda to share with you the success that they are getting with the same vaccine that we are providing to all African countries today. The vaccine that Rwanda is using, and I was told that they started 2 days ago, they already got around 500 people vaccinated. They got 1,000 doses, and they need more than even what they requested, the 10,000 doses. This is a way for us to consider that when countries, they send the planning for the vaccination campaign, maybe they didn't realize till where they can go with population requesting this vaccine to be protected. And our team is working with countries to update the vaccination plan. As you know, we are talking about 10 million doses. And we are committed to make sure that Africa will have these 10 million doses, at least, to protect our people. We are also celebrating a great news, that is the WHO pre-qualification for the Bavarian Nordic vaccine. It was a success that we celebrated, all of us, WHO, AfricaCDC, and all partners, because for a very long time, we wanted this vaccine to get the WHO pre-qualification and to be procured by UNICEF, Gavi, all partners, and to be made available to African countries. With the WHO pre-qualification, we can say, and we can communicate to our communities that the vaccine is recognized safe by WHO. There is no worry to use that. In addition to the Bavarian Nordic vaccine, we have also the Japanese vaccine. This Japanese vaccine, as you saw yesterday, officially the government of Japan signed with DRC the donation of the 3 million doses. And we are working with the government of Japan. Immediately after this press conference, you'll see the joint press release that AfricaCDC will make with Japan on the way we are working together to strengthen the capacity of African countries to stop this outbreak. We are also celebrating the deal signed by Gavi and Bavarian Nordic for 500,000 doses. And we'll work with Gavi for colleagues to understand that allocations are made by AfricaCDC to all African countries. And I have no doubt that Gavi will follow this route. We are supporting DRC, CAR, and other countries to finalize the vaccination plan. As you know, DRC will start the vaccination campaign the first week of October. And we have no doubt, because we'll allocate additional doses to Rwanda and CAR, South Africa, Uganda, Burundi, and any other country that will be in need, we will see Africa speaking loudly about the success that we'll get with this vaccine. But to make sure that countries are well prepared and their plans are ready, we are establishing a technical review committee comprised by strong African experts who can start to sit with countries and to help them to have strong vaccination campaign plan, and that will help to stop the spreading of Mpox in Africa. We have our science pillar following everything that we are doing, understanding with the vaccination that started in Rwanda and also that will start in other countries, what would be the lesson that we can learn from that and to support other countries to move forward with the vaccination? Next slide. When we talk about vaccine, we talk about surveillance. We have to talk about laboratory. I'm joined by my colleague, Dr. Yenyo, who is the Director of Laboratory Network in AfricaCDC. We will share with you, when you will have some questions, what we already did as AfricaCDC to support our member states in this area. Last week, I was sharing with you that some countries, for the first time, they are getting sequencing, genomic sequencing capacity. We are expanding this capacity in Central African Republic. We are giving youth support to Burundi. This week, there is a training to install, to activate this genomic sequencing. And we are moving also in Sierra Leone and other countries. We also know that in many countries, thanks to Global Fund and other partners, we have what we call the Gene Expert machines. But these Gene Expert machines, we didn't have the cartridge. And we procured around 28,000 Mpox test kits and Gene Expert cartridge that we are distributing to our member states who are affected or at risk. We are also doing the same about training lab experts to ensure that they are able to test and to report on what they are doing. There is still a major challenge, and that one is leading for the low testing rate that we can see in Africa. It's about how we are collecting samples and how we are transporting samples. We are providing support to countries to reduce this burden. And for the next 2 weeks, we hope that we'll increase the testing rate by appropriate support that we will give to countries. Next slide. We wanted to show here how we are working together and what we are generating. We are talking about the dashboard. We want to be accountable. We want to be transparent. From next week, we'll share with you a link where you will go, you will click, and you'll have everything we are talking about in terms of epidemiological situation per country, per region, and at the continental level. You have a window for how much did we get from who and where this money is going. Because we don't want our member state not to be recognized for the huge effort they are doing. I was in Burundi, the government was informing me they already provided $1 million to support the response. DRC, they said they already provide 10 million to support the response. We want to recognize that. And we know that there are so many other countries providing funding to stop this outbreak. We want also to have a specific window for logistics, for all of us to see what are we getting in terms of vaccines, in terms of syringes, in terms of masks and any other medical countermeasures, and where it's going. Currently, we are finalizing an agreement with Indonesia for a donation of tecovirimat. That will be mostly for countries affected by the clade 2. Everything will be transparent. And that one will help us to have, as we say under the new public health order, a respectful partnership. And to know what is the level of effort from all of us. As you know, the continental coordination mechanism is in place. As you know, we are still working to have a rapid test, that is the antigen test, that can help us to strengthen the capacity of our communities, community health workers, and our health workers who are at the border to conduct the cross-border surveillance. Because for now, we have some issues to conduct the cross-border surveillance. And we are still working in terms of other policies and documents that we need for vaccination, for surveillance, and for the lab aspect. Next, please. With that slide, we say thank you to you, and we are ready for your questions. As I said, we invited our colleagues from Rwanda. We hope that they got the link. If they are there, they will be more than happy to answer, because the minister tested me, is leading the meeting, the pandemic fund meeting, discussing about funds allocation. And I hope, as I said clearly to pandemic fund, we are hoping that this meeting will lead for appropriate funding to Africa to fight Mpox. Over to you, Margaret.
Thank you, Gigi. Let's open the floor for questions. Paul from the Lancet, you have the floor.
Hi, good afternoon. This is Paul. So I have three questions for the DG, and the first one has to be around keeping track of how many doses of the vaccine that we have now. So can you give us where we are in terms of how many definitive donations do we have? And Nigeria was the first country to receive these vaccines. Do we know, can you share insights on what the country's vaccination plan looks like? And another question I want to ask is, the attention seems to be on this vaccine. What about other means of interventions? What is the current state of the testing capacity? You mentioned that we still need testing kits, but on average, can we have insight into the number of tests that are being done? And what about treatment? What kind of support currently exists for treatment, especially for those that will not benefit from the vaccine that had already been infected? So what insight can you share about the support for treatment? Thank you very much.
Thank you, Paul. Over to you, DG.
Yes, three questions, and I will answer, and my colleagues, they will provide maybe additional comment. Where are we in terms of donation of vaccines? I think we need to understand, as we said, we don't have one outbreak. We have at least 3-4 outbreaks in one. And we have some specificities in terms of vaccines. You will see the Japanese vaccine is mostly for young people, while evidence that we have for the Bavarian Nordic vaccine is mostly for 18 plus. And we have some studies saying we can still use that for 12 plus. For countries like DRC, Rwanda, Uganda, Burundi, Congo Brazza, where we saw the clade 1B circulating, affecting young people, the Japanese vaccine is also, is appropriate to be used. And we got 3 million doses from Japan. We got 250,000 doses from 15,000 doses from HERA and Bavaria, this tripartite agreement that we signed, AfricaCDC, HERA, and Bavaria. Out of these 215,000 doses, we already delivered 200,000 to DRC, and the 15,000 will be delivered in the coming days to additional countries, as I said. We got 50,000 doses from the US plus 15,000 doses from Gavi. that were delivered to DRC a few days ago, bringing the total of vaccines to DRC to 65,000 available. In addition to that, we have commitment from France for 100,000 doses, from Spain, 100,000 doses, from Germany, 100,000 doses, and from Canada for 200,000 doses. We still have some gaps. We are working to see how to fill this gap. But we have to make it clear and loud. For us to fill this gap, we also need this vaccine to start to be manufactured in Africa. And we are working strongly and closely with our manufacturers, but also our partners to have this vaccine manufactured from one of the African countries. In terms of, there are so many players involved. Yes, there are so many players involved, but there is only one incident management team. And we want to be clear on that. As AfricaCDC, we are leading this continental response by knowing that we are working with all other partners. We will not accept again the fragmentation that we saw in the past, because that fragmentation led for an inappropriate response. For the first time that we have this continental incident management team, we want all partners to come to sit together. I want to welcome all partners like WHO, UNICEF, Gavi, MSF, and others like UK, US, and others who already sent colleagues to sit in this team. We know that we have 26 partners working together. And let us strengthen this mechanism. And let us give chance to Africa to win today. The flag issue must stop. What must continue is the African agenda. In terms of treatment, I was talking with Professor Muyembe today. You know, Professor Muyembe is leading INRB, this National Institute for Research. He told me that he's in one of the regions in DRC called Maniema to finalize the study about tecovirimat. And we know we have the treatment for clade 2, but we are still looking for treatment for clade 1, especially 1B. And we hope that with everything our colleagues are doing, from our side, we have Dr. Mosoka leading this agenda of research with many African institutes. We hope that in a few days, we'll have some news, good news about treatment. I don't know, Dr. Ngashi, if there is something I missed, and the team, you can maybe provide additional comment. Dr. Yenyu, please go ahead.
Yeah, thank you very much, DG. I think just to say that you've covered most of the important points. Perhaps there's a few additional points to say that on the treatment side, the treatment that is recommended now for the management of cases of Mpox has got 3 components. I think we have the clinical side, we have the nutrition side, and then we have the psychosocial support. I think on the clinical side, although we don't have tecovirimat, which has proven, as you rightly said, not to be efficacious in the populations where it was tested here, but the treatment still remains symptomatic. That covers really good rehydration, management of pain, and also the prevention of infection of the lesions. in addition to that, good nutrition and also good psychosocial support. I think that is still working, as you rightly said, for Burundi, for example, where almost everyone is hospitalized and isolated. I think they're still having 0 days. To say that even if we don't have those antiretrovirals that we expected to have, we just need to make sure that what the package that is recommended now is fully delivered to the patient. And I think there was also another question on the testing. Since Dr. Yenu is there, I think we can allow him to cover that aspect.
Yeah, thank you, Dr. Ngashi. Thank you, DG. So I want to respond to on the question related to testing. I think first of all, it's good to remember that we test only suspected and probable cases. Those people coming with some symptoms. It's not like COVID, where we test also asymptomatic people. So our overall testing rate is 52%, which means that 52% of all suspected and probable cases have been tested. And our plan is really to take that number to above 80%. So with the capacity building activities and test kit supplies and training and so on, we hope that we can reach that target. So we are working towards that target. Thank you.
Thank you, Dr. Yenu. Let's take the next question. Carmen from Politico, you have the floor. Carmen, can you hear me? Okay, let's move on to the your own comment.
Hi, can you hear me now?
Yeah, we
can you hear me now?
Yes.
Okay, thank you. It took a little bit for the call to unmute. So I have a few questions. The first one actually is not a question, but I am based in the Washington, D.C. area. So if the DG has any media availabilities while he's in town, I would love to hear about it. In terms of the vaccine from Japan, do you have an estimated arrival date? And do you expect that it will go to the DRC first? And then my other question was about sort of like the vaccines arriving in the DRC. A few government officials in the US that I've spoken to said they have offered vaccines for Mpox to the DRC and other countries in the region for a year and a half or more, but that they were no takers. And I was wondering why that was. Was it because Mpox was not so much of a priority given the other challenges that the country was facing? Was it regulatory issues? Like, I was just trying to understand why it took another health emergency declaration for the vaccines to arrive in the DRC, where we knew that, at least in some parts of the country, Mpox was endemic. Thank you.
Thank you. Over to you, DG.
Thank you so much, Carmen. I think my colleagues, they are taking notes for my availability. Maybe they can find a window for us to meet because I'm in DC. We are talking with the government of Japan. Yesterday, they signed the MOU officially with DRC. As I said, we are releasing a joint statement today. We are working with them in terms of logistics and all other aspects, because announcing a donation is one aspect of the response, but bringing this vaccine in Africa and where people they need it, it means in all areas that comprising also rural areas, having a strong communication campaign conducted, trying to understand how we can conduct a campaign at the same time with two different vaccines. All of that, we are working on that, and we'll come back to you when we'll also discuss with DRC authorities to know exactly when we can receive this vaccine. For now, we don't have an answer to this question, but we are working on that. Why DRC and other countries, they didn't accept vaccines before? Let me be clear on that. Let me be loud on that. I consider Mpox as another unfair treatment that Africa faced during COVID time. As we know, from 2022 to 2023, Mpox was declared public health emergency of international concern. But at the same time, we had cases in Africa. The same vaccine we are talking about now was manufactured, distributed, used in Western countries. None of them was thinking to give vaccines to Africa. For reasons I don't know till now. That one didn't help to build trust, because vaccination is also a trust issue. Now, when this outbreak was stopped, when the public health emergency of international concern status was lifted, we started to see some partners coming even to make what we believe could be inappropriate response. How do you want a country requesting at least 3 million doses? A partner can come and say, I can give you 5,000 doses. How do you want this country to accept the 5,000 doses when they know that in 1-2 days, they can use the 5,000 doses and then they have no other solution? This is why AfricaCDC came strongly. I'm proud as AfricaCDC Director General to say, it's because of AfricaCDC that today this agenda is moving. It must be written, it must be said, because we started to request our partners to be more serious on the way they are engaging our countries. We started also to say to our countries, please accept vaccine. In April 2024, AfricaCDC organized a meeting in DRC with 11 countries. Some of them were represented by ministers, 7 countries. This meeting, the major outcome of this meeting was DRC finally accepted to use vaccine, finally accepted to conduct clinical trials, finally accepted to use medicine if it's available and appropriate for the epidemiological context. It's AfricaCDC that did that. After April 2024, we started now to advocate for more commitment, for more doses. Today, we have almost around 4 million commitment of doses. 4 million doses as commitment. But we say we need more. And I'm hearing some partners saying you don't need more. No one can tell us what we want to do and what we need to have for our continent. It's not about, we are not conducting that based on the availability of vaccine. We are conducting that based on the need as guided by epidemiology and the continental response plan that we developed. I think I responded to your question, but we can discuss that when we meet physically. Thank you.
Thank you, DG. Let's take 2 more from the chat group. Alexandra from the Italian news agency asks, Dr. Kaseya, you mentioned that Mpox is not under control in Africa. When do you feel to be considered under control? And then the next question comes from Evelyn, who's asking to elaborate on the vaccination starting in Rwanda. When did it start? We can take those 2, DG.
Yes, I will answer the first question, and then my colleagues, they will answer the second one. And as I said, if the director from the Rwandan ministry is attending, is free to respond. About the first question from Alessandra, I think Margaret, are you there? Because I had it in the chat. I want to make sure that I got it nicely because there was I was stopped here. Okay, when can we say that Mpox will be under control? I think from day one, we started to show this slide with cases in 2022, they increased in 2023, they increased in 2024. When we declared Mpox as public health emergency of continental security, we saw that from 2022 to 2023, there was an increase of 79% for the same period of time. And for the same period of time, there was an increase of more than 160% from 2023 to 2024. It's not me who will declare that it's under control. It's what we call the emergency consultative group, where we have all scientists, African scientists, sitting, analyzing data. But based on the discussion that we have, we can say, because Mpox is endemic in Africa, in some countries, we can say that if we reach the level of 2022, we can consider that Mpox is under control. But I will let our scientists to come and to tell us what will be advice that they can give to the Director General. First, to say that Mpox is under control. Second, to provide guidance on if we need to lift the public health emergency of continental security status. Dr. Ngash and colleagues, if you can respond to the second question related to the vaccination campaign in Rwanda.
So yes, Rwanda began immunization on the 17th of September, following 2 weeks of engagement with Nigeria to have bilateral engagement. They targeted 7 districts based on the risk profile district that share border with DRC, and then they targeted high-risk group like those that are truck drivers, sex workers. But they actually began on the 17th, and they were able to vaccinate around the first 300 high-risk population in Rwanda. Thank you, sir.
Thank you very much. Let's take the next 2 questions. Sarah Jerving from DVEX, you have the floor.
Thank you so much. Is the Japanese vaccine working to get WHO pre-qualified, and does that impact AfricaCDC's ability to use those doses? And have any African regulatory bodies approved that vaccine? And then I'm wondering if you can also give some more details around the new deal with PAHO. Thank you.
Thank you, Sarah. Let's take the next one. Janice from Bloomberg, you have the floor.
Hi, thanks very much. My question is also related to the Japanese vaccine rollout. I realize that the talks have only wrapped up recently, but I'm wondering if the Japanese vaccine should be prioritized as a treatment for exposed children who we know have a higher chance of dying. Effectively, should be used as a post-exposure prophylaxis. And then in Burundi, is the focus on children that are exposed, getting them vaccinated with that LC16? And if so, does that entail training health workers on how to use bifurcated needles and educate parents about scarification? And my last one related to that is just, I know that someone asked this already, and I might have missed this detail in the answer, but again, appreciating that these talks have only recently ended. Do we have any estimate, ballpark figure of when these inoculations are likely to arrive?
Thank you very much. Over to you, Didi.
Thank you. I will answer to the first one from Sarah, and then colleagues will answer to the second one. The Japanese vaccine, they submitted the dossier for the WHO pre-qualification. We are also calling colleagues from the WHO pre-qualification team to start to give priority to what is affecting Africa. I made it clear to all colleagues that we feel the WHO pre-qualification being a major limitation in our local manufacturing agenda in Africa. And there is no reason for them to delay this process. And let me congratulate my brother, Dr. Tedros, who even made a clear decision based on data that was available to even issue the emergency use authorization for the Bavarian vaccine even before getting the WHO pre-qualification to allow UNICEF and Gavi to procure this vaccine. As you know, all of these vaccines were manufactured some time ago, were used, and data are available to show, to talk about the impact that they had to reduce or to stop the outbreak in other continents. When we don't have a WHO pre-qualification, we request countries, based on data that are available, to issue what we call the emergency use authorization. This is what we did in Europe, in the US, and in DRC, in Nigeria, in South Africa, for the Bavarian Nordic vaccine, and this is what we did in DRC for the Japanese vaccine. In the same time, AfricaCDC, we are doing our best to follow up on everything that is done to make sure that this vaccine will continue to protect as it protected in other continents. Our NRAs are working closely with WHO, with AfricaCDC, to provide this emergency use authorization. And I can tell you, for what we saw since this outbreak started, for communications that we have with all NRA's leaders, we can tell you, I see excitement. I see people are working so hard to support the response by bringing a strong and gold standard regulatory advice and decision. When we talk about power, we also talk about all of this unfair treatment that the global south faced. We are talking about a continent of around more than 1 billion people. If we talk about power, we are talking about 1.4 billion in Africa. We are talking about 2 blocks that had to suffer about access to medical countermeasures, even during the COVID time. We said, now it's time for us to wake up. You'll see, and I don't want to talk about what will be signed. The MOU that will sign tomorrow with power, it will be a revolution on the way now Africa and Latin America are taking seriously their independence in terms of public health. Because we are there to lead this aspect in our different continents. And Sarah, believe me, you'll be one of the first people, I think Margaret will share with you this MOU that will be made public tomorrow. And the ceremony, I think, will be covered by your journal. Dr. Ngashi and colleagues, can you please proceed for the second question?
Dr. Ngashi? But okay, the data that we have published recently on S16 shows that, again, inoculation with the Japanese vaccine is an effective post-exposure prophylaxis. So particularly in those in close contact with patients. So that's a little bit the difference with what we're seeing with the Bavarian Nordic vaccines. So the advantage, again, if you look at the epidemiological data, we have seen currently is driven primarily around children less than 15 years of age. So it's going to fill that gap in terms of access and, again, equity to vaccines. Back to you, DG.
Thank you very much. And with that, we've come to the end of the briefing for the day. I will now pass it on to the DG for his closing remarks.
Colleagues from the press, we thank you for being there today. As you know, now every Thursday, we wanted to adjust, as we said, to make sure that countries are coming also with data that we take them to analyze before feeding you. Then everywhere will be, except in the moon, we'll have this press conference on Thursday. We wanted also to share with you that this event that will take place on the 22nd, it means the meeting of head of state of African countries, because they are leading the agenda in their respective countries and at the continental level, will help us to say that we are moving. We hope after this meeting and some ongoing meetings, for the next press conference, we can be able to tell you, out of the $599 million we need, plus 10 million doses, we can tell you, and we can give you an accurate figure. And we commit also to give you this dashboard. I want to thank our colleagues from PATH, working with AfricaCDC, WHO, and all other partners to put in place this dashboard. And we wanted also to commit to you that we'll continue our effort for the vaccination campaign to take place in a number of countries. As you saw, we decided, based on the information that we have, to postpone the CPHI, the Conference of Public Health in Africa. This decision is giving us a relief in terms of where we need to focus our energy, our time, because this outbreak must be stopped very quickly. With that, I thank you, and I hope that on Thursday when we'll meet, we'll have more update for you in terms of how the response is moving. Thank you so much for your attendance.